Today, we're talking about high D drop 76 Mcg-1 000 mcg/ml Oral Drops Multivitamins. This medication is a multivitamin product used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. Vitamins are important building blocks of the body and help keep you in good health. It's important to take this medication as directed by your doctor or pharmacist. The daily dosage and optimal timing will vary depending on your individual needs and health conditions, so be sure to follow their recommendations. Remember, it's always best to consult with a healthcare professional before starting any new medication. When taking high D drop 76 Mcg-1 000 mcg/ml Oral Drops Multivitamins, it is important to follow the directions provided by your doctor or on the product package. It is typically taken once daily, and it is important not to exceed the recommended dosage. Using a medication measuring device to carefully measure the prescribed dose is crucial, and if the liquid is a suspension, be sure to shake the bottle well before each dose. Taking this medication regularly at the same time each day will help you get the most benefit from it. It is important to remember to take it consistently to see the best results. Some common side effects of high D drop 76 Mcg-1 000 mcg/ml Oral Drops Multivitamins may include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience any serious side effects. While rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, it's important to seek advice from your doctor or pharmacist. For those in the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. It's important to keep products that contain iron out of reach of children, as accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. If overdose does occur, it's important to seek medical help right away or call a poison control center. Before using high D drop 76 Mcg-1 000 mcg/ml Oral Drops Multivitamins, it is important to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions. It is also important to discuss your medical history, especially if you have a history of alcohol abuse, liver problems, or stomach/intestinal issues. If the multivitamin contains folic acid, it is crucial to inform your doctor if you have a vitamin B12 deficiency before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating the anemia, which may lead to serious nerve problems. It is important to consult your doctor or pharmacist for more details. Liquid preparations of this product may contain sugar and/or alcohol, so caution is advised if you have diabetes, alcohol dependence, or liver disease. It is important to discuss the safe use of this product with your doctor or pharmacist. Before undergoing surgery, it is important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it is important to inform your doctor before using this medication. Additionally, if you are breastfeeding, it is important to consult your doctor before using this product. It's important to be aware of potential drug interactions with high D drop 76 Mcg-1 000 mcg/ml Oral Drops Multivitamins. These interactions could impact how your other medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Also, do not start, stop, or change the dosage of any medicines without your doctor's approval. If your multivitamin contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. It's important to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin contains folic acid, be sure to inform your doctor or pharmacist if you take certain anti-seizure drugs. This information will help them provide the best guidance for your specific situation. If someone takes too much of this medication and experiences severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, you can reach your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Signs of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's crucial to take the recommended dosage of this medication and seek prompt medical assistance in case of an overdose. Remember to keep up with all your medical appointments and lab tests. It's important to note that these drops should not replace a healthy diet. It's always best to get your vitamins from nutritious foods. Make sure to maintain a well-balanced diet and follow any dietary recommendations given by your doctor. If you forget to take your high-D drop 76 Mcg-1 000 Mcg/ml oral drops multivitamins at the scheduled time, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed one and take the next one at the regular time. Don't take double the dose to make up for the missed one. It's important to follow the prescribed schedule for the best results. When it comes to storing high-D drop 76 Mcg-1 000 Mcg/ml oral drops multivitamins, it's important to keep it at room temperature and away from light and moisture. Just make sure not to store it in the bathroom, and always keep it out of reach of children and pets. And when it's time to get rid of this product, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. It's important to follow these guidelines to ensure the safety and effectiveness of the medication. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.